to the COVID status of the country. A rise in daily COVID case counts and several states issuing mask advisories actually bringing back grim memories of the pandemic that locked us indoors and wrapped us in fear for about 2 years. In fact, a total of 358 COVID cases have been reported across the country just in the last 24 hours. 300 of them are actually in Kerala. 6 people died due to COVID-related implications during this period. The COVID count as far as the country is concerned, the active cases stand at 2,669. These are the statistics that the Union Health Ministry has released. The daily COVID count of 614 cases reported yesterday, the highest since May, has set off alarm bells. This spike in infections is actually driven by a COVID variant named Jn.1. And amid the uptick in COVID-19 cases, once again, health experts suggest that people should consider wearing masks, especially in public places, to contain the spread of the infection. Joining us for further clarity on the matter, member of the Maharashtra COVID Task Force, Dr. Hemant P. Thacker. Thank you so much, Doc, for joining us. Doc, is the new COVID variant more dangerous than the previous ones? What do preliminary findings indicate? And is this new variant life-threatening?
So at the outset, I want to placate everybody's fears. This is a new variant, but it is not any more dangerous than what we have already experienced.
Right.
It's, after all, an Omicron variant. And Omicron had the traditional BA variant, which we called Pirola. And this is a little different from Pirola, which we call as Jn.1. And the only difference is there is a morphological protein difference. But all that is semantics. What does it mean for the common man? It means that when you have a flu, which is runny nose, cough, throat irritation, mild fever, headache, and maybe a loosish tummy, and if it carries on for a little more than normal, you have to think of COVID. Now, how do you prevent it? There are only 2 ways to prevent it. One is the safety net of masking. And this masking, I'm not asking you to mask across the board. If you have to go to a mall, if you have to go to a place, a public place where people cannot distance themselves, then you need to wear a mask. I would try anyway in the winter months when you go to see a theater or an auditorium association, you hear more coughs and colds and sneezes than actually the show. So I would not go to these places.
Right.
And then the other thing is to take the influenza vaccine. The influenza vaccine will protect you against the common flu and will also give you some degree of protection against these COVID variants. So don't fear, but don't take it lightly.
Right.
Stay away from crowded places. If you have to go to weddings and parties, which India is now very much back in the fray, please wear your mask. Try and distance yourself. If you have a cough and cold, keep away from other people. Try and treat your cough and cold. And if in a couple of days it doesn't improve, look for the COVID. COVID, according to CDC, according to US, according to our experts, this Jn.1 variant is not severe. Of course, it is a little more transmissible than the Omicron regular variant, but that should not worry us. That should not scare us. That should only tell us that we have to be a little more careful. In the cold, viruses tend to jump from person to person.
In fact, I'm going to come to the transmissibility aspect in just a moment, Doc. But like you've mentioned, it is important to know that currently there is no evidence suggesting that this variant is more severe or has higher death rates compared to other variants. But experts are also suggesting of taking the influenza vaccine, as Dr. Thacker has just said. But Doc, take us through the Jn.1 symptoms one should not ignore at this stage.
So Jn.1 symptoms will begin with a regular flu, a runny nose, sneezing, headache, body ache, cough, irritation in the throat, and sometimes also a loose, runny GI tummy. If these go on for more than a couple of days, which usually the flu comes under control, the routine winter flu, then you have to think about this being a COVID variant which you have picked up. The reason why you should test is you could prevent spread of the infection by isolating yourself as a form of social distancing, masking, and not exposing yourself if it is not required. But
Right.
as of now, we do not know about respiratory distress. The patients that have suffered have not come with acute large pneumonias requiring a lot of oxygen, medication, intravenous, other things.
Right,
But
but
that
in
does
terms
not
of
mean that it
current
can worsen.
vaccines, Doc, in terms of
Sorry?
current vaccines, we know that they're seen to protect against severe disease and death. But is there any need for a widespread call for booster shots at the moment?
Not at all. But
Right.
I would definitely raise a clarion call for influenza vaccine. In
Like you
India,
mentioned.
influenza vaccine is still underutilized. Use the influenza vaccine. There's no reason for people to make a beeline for the booster, COVID booster.
Right. Amid the uptick in cases, once again, though, health experts are suggesting that people should consider wearing masks, especially in public places. In fact, some places like Chandigarh are also making it mandatory. But Doc, I want to know, you mentioned it's wedding season, it's also festive season. Are you going to be making changes to your plans in the months ahead, or is it going to be business as usual, and should it be business as usual for us as well?
Well, it should be business as usual, but when you go to these crowded places or groups of people, it would be preferable to wear a mask only during that time and to tell people, spread the word that if anybody has upper respiratory symptoms, don't attend the party, don't attend the function. And it is safe to wear a mask. It is better to wear a mask, better to be prudent and safe rather than to be sorry. You don't even want the mild variant to hit you. Why should you have anything hitting you? If you
Absolutely.
wear a mask, it won't, you'll be protected.
And considering that a number of countries are actually entering winter season, respiratory infections may also see a rise. So will COVID, perhaps. How does one differentiate?
So the only way to differentiate as of now between the winter respiratory flu and the COVID variant infection is the test, because the symptoms overlap. But here's what answers your very important question, that with a lot of countries entering the winter season, when you wear a mask, which we did during the pandemic, other respiratory ailments also came down. So if you did wear a mask, especially in the crowded and even to work if you need to, you will find the incidence of flu also coming down, which is desirable. A lot of people in winter get flu. वो भी कम हो जाएगा if you wear the mask. So
Right.
masking, if you are susceptible, if you are going to a potential area, is a great idea.
Right. As we wrap, Doc, Dr. Soumya Swaminathan, the former World Health Organization chief scientist, has cautioned against dismissing COVID as a common cold, not just because people who fall severely ill, but because of the disease's long-term effects. This could also, as you know, include increased risk of heart attacks and strokes and mental health problems. What's your assessment?
You know, COVID has been the famous whipping boy of any and every complication post-pandemic. I'm not trying to take away from the fact that COVID virus could be leading to some antigen stimulation, which causes all these issues that have been described. But the fact remains that any and every complication post-COVID is not necessarily due to COVID. The question which Dr. Swaminathan and which all of us are trying to answer is protect yourself. Take prompt therapy if you have symptoms. And don't stick your neck out and go to the wrong places unprotected. I think that's important. She has heightened the importance of the problem and not scared people. Probably the only way people will remember and realize to take care is if you scare them. So if she's used a carrot and stick approach, it is applaudable.
Right. I'd like to emphasize the need for common sense in navigating the upcoming festive season, advocating for hand washing, mask wearing and other preventive measures, as Dr. Thacker has just emphasized. Thank you so much, Doctor, for joining us on NDTV. As far as the Jn.1 COVID variant is concerned, monitoring its transmissibility and impact on immunity is crucial, and both India and the international community are closely observing these characteristics.